most famous physical therapist on the internet.
Pump it up, Brad.
Pump up the
Strong like
volume.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Here we are, the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Should you have knee surgery, arthroscopic, replacement, meniscectomy? We're going to discuss it today in today's video.
Sure. So keep your ears open, but before we go too far.
Eyes open too.
Oh, yeah.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, we're real excited. We're giving away something really cool again right now. We're going to do it on our social media channels. You can also join us on bobandbrad.com and go to the giveaway section.
Sure.
Or Facebook, Bob and Brad.
Yeah.
We're giving away the RENPHO Foot Massager. This thing is awesome, isn't it, Brad?
Yeah, it's for your feet, obviously. You
you stick both feet in there. And
with your shoes off.
Yeah, that's right.
Yeah. And,
and your socks on.
Yeah, it
does
compression for fluid reduction as well as massage all at the same time.
Yeah, it's really comfortable. It really works well. So today we're going to talk about kind of the whole ranges of surgery. There's the ones that are just the arthroscopic, where they go in and sometimes they just clean things out a little bit or repair the cartilage or debride it. Mm-hmm. Do the lavage, where they do a little bit of water and cleaning and all that. But
they got a number of procedures they can work
all
with.
the way up to knee replacement. We're going to discuss the two. So the first one we're going to talk about is the arthroscopic surgery. Should you have it? You're having knee pain, you're having problems, and you're like, they found out I have a torn meniscus or something, and or torn cartilage. Should they go in to do this? Well, according to the guidelines by the Royal Australian College of General Practitioners, they developed these guidelines both in 2009. Now they revised them in 2019.
Oh, so just this year?
Yeah.
Okay.
They have a strong recommendation against arthroscopic meniscectomies, cartilage repair, unless the knee is locking on you.
So it literally locks up. You can't move it. It's painful typically during that episode. And typically it unlocks. You get it to move around, and then you're okay again. And if you have that, you probably have like a floater or a mechanical.
The meniscus or cartilage may have folded over on itself. Mm-hmm. So there's something that they do need to go in and take care of. What they're often finding is that if you have it and you don't have a locked knee, is that quite often the knee's not going to be any better than if you wouldn't have had the surgery in a few months or a few weeks down the line.
Sure.
So it's just they had a strong recommendation. It wasn't just a recommendation, it was a strong recommendation against it. All right, how about knee replacement? Now that's a whole different story. You're getting to the point where things are bad. These are some of the questions you should ask yourself. I have them written right down here, Brad.
There you go, all documented.
Number one, this is the first question you should ask yourself. Have you tried less invasive measures?
Right.
I mean, have you tried Bob and Brad's therapy?
Right. We have a number of videos on, range of motion. Keep that knee moving the best you can. There's options that you
have you used a cane?
Right.
Because knee. What we find is arthritis and knee joint deterioration. It tends to flare up and it tends to calm down.
Sure.
So make it through the tough periods, and maybe your life isn't going to be so bad.
Right.
Get
the range of motion better, and you may have a real pleasant experience and get a lot more life out of that knee.
They do recommend, by the way, that guidelines. They said you can definitely try injections as far as steroid type injections.
Steroid, but not the rooster comb.
Not the rooster comb. They did not. They recommended against that.
And that was the Australian study. Okay.
Yeah. So again, you can look that up. The Royal Australian College of General Practitioners. It's for non-surgical management of hip and knee osteoarthritis. So if you have either. Second question: are you needing help right now doing your daily life because your knee is so bad?
Right. So getting up and down stairs becomes a real problem. You're going one step at a time, favoring the sore knee.
Or you can't do certain things because of it. You're relying on other people. You're becoming a burden.
Exactly.
So
you no longer can squat down.
Yeah, you can't clean the floor. You can't. Right. So you can't wash or polish my shoes, Brad.
Go on, Bob.
I don't know where I was going with that, but do you have really bad pain daily? Does your pain continue even when you're at rest? Mm-hmm. That's starting to be a sign then that things are getting bad.
Right.
Another one is if it's hurting at night. that you went on it all day and it's not allowing you to sleep.
And that's a
bad one.
chronic thing. It's
Yeah.
just not for a night or two here and there throughout the year. It becomes a chronic nightly situation. And with knee pain, people know they have arthritis oftentimes, and they don't want to do surgery. Which is completely understandable. But however, there gets to be that point where
It's time.
how many patients have you had after their knee surgery did they say, "I wish I would have done it years
sooner.
ago"?
Yeah. And that's a good point to make as far as how long does a knee replacement tend to last, Brad?
Well, I think now they're saying 15 to 20 years is not uncommon.
Right. So you got to keep that in mind. Yes, if you're younger, you may end up having another one. But to me, you have to weigh that against, do you really want to suffer for the next year or two or three?
Sure.
And when you could be enjoying some of the best years of your life. You know what I mean?
Right. Yeah. If you're 55 and your knee is so bad that you're having a hard time doing things.
Right.
If you get a knee replacement, it brings you back up to 80, 90% of your normal activity.
Right.
The rest of your body's there. Your mind is there. You got those 15 prime years of life. If you wait 15 years and you're 75, you get a new knee. Well, your knee is good, but other things might be falling apart.
And that's a good point too, is that whether or not you'll even be able to have the surgery, if you medically can tolerate it.
Right.
I mean, you need to ask yourself that now, because if you ask that and you can't, well, then this is done. You don't need even to watch this video.
Sure.
But if you can tolerate it now, are you going to be able to tolerate it 10 years from now? You may not.
Right. Especially, there are some conditions that if you have some pre-existing conditions.
It happened to my grandpa. He waited too long, and I mean, he lived into his 90s, and he should have had hip surgery replacement, and it ended up disabling him because he just kept putting it off, and then he couldn't have it. It was too late. So
a lot of things to think about.
Yeah, it is. Are you tired of being relying on medications? Because medications can have side effects too. You were mentioning, Brad. That
if you're ibuprofen, your stomach, is your stomach going to take it? Your liver.
Your liver.
Right.
So you can be doing damage by being on high levels of ibuprofen.
Chronically, if you're doing it.
Yeah.
Months and months at a time.
I mentioned, is it keeping you awake at night? The question that I really ask a lot of people, the final question is, are you just sick of the knee pain?
Yeah.
I mean, and a lot of people go, yes, I'm just sick of it. Well, it's time then. The other one I'll bring out too is a lot of people go, well, they're just hobbling around like this. I'm like, and they're going, I just don't want to have the surgery. And it's like, it's very evident to people that you got a problem. And there was one girl at one of the nursing homes we're at, she's hobbled for years, and she finally had the surgery done. It's like, it's just weird to see her walking normal because I was so accommodated.
She was an employee?
Yeah, she's an employee.
Okay, sure. And the other thing is, if your knee is getting so bad that you compensate your walking or your gait, you could throw your hip or back or other knee off because the bad knee. So the bad knee is causing other problems in your body. So we don't want to get to that point either.
My tendency on knee replacements is to honestly sometimes to have them more sooner than other people think. That's my opinion. I just think some people, like I said, too many people wait too long.
Right.
It's just so.
And I don't know exactly what the stats are, but I'm quite certain you can say 90% do very well.
Very, very well, yes.
And you hear some of the horror stories of people who had problems, and I've worked with them, but almost, I would say
it's so rare.
Yeah.
And some of them, the reason they have problems is because they waited too long. I mean, seriously, I had some people that I think, they had so much contractures already in there that.
But, for your knee, just take this with a grain of salt, listen to us, talk to your surgeon
Talk to your
about
surgeon. This is a decision you make with you, your family, the surgeon,
Right.
And
they're the big players. We're just throwing some good things to think about for questions,
That's right. Food for thought.
There you go.
All right. Thanks, everybody, for watching.
What about the broken heart, Bob?
Oh, do you want to say it?
Yeah.
We can fix just about anything
except for
a broken heart.
There you go. We got time, 9 minutes.
All right. We're working on it. We're working on it.